and Philip Ward, Editor-in-Chief of Mini Europe. AI has, as we all know, has been a central theme this week at the Congress at ECR 2019. I'm very pleased to have with me Dr. Hugh Harvey, who's been very busy co-moderating at the AI Expo. Hugh, thanks for joining us.
Thank you for having me.
Good. Could we talk a little about the radiologist's role in AI and start with clinical validation, because I think this has been a favourite topic of yours for the last few months. Is it still lacking that clinical validation in AI?
I'd say so. So far, out of the companies and industry vendors that are presenting here at ECR, there's very few that actually have full prospective studies completed, myself included. And I think the reason for that is it takes a long time. It takes time to gather the data, to get the consent, to go through the de-identification processes, to label data, to get a ground truth, to actually run these studies in a clinical environment. There are a handful out there, and some have received CE marking, FDA clearance. But I think what we're going to see over the next year or so is the results of these big prospective studies happening in the real world, in a real clinical environment. And I'm really excited to find out more about what's going to happen.
So for our viewers, how can they look out for clinical validation? Where should they go for that information?
So I think the gold standard is to have your results peer reviewed and published in an accepted academic journal. There's a tension, I think, between the data science side of things, where you want to show your research off, but at the same time you maybe don't want to give away your proprietary underlying algorithmic code to give that away for free. So there is that kind of tension, and I think the balance is being struck to a certain extent by going down the clinical validation route, whereby you get an independent clinical researcher to evaluate your algorithm independently of you. So it's not the code of the algorithm that is the focus, it's the clinical outcomes and the impact on patient care that's the focus.
Okay, excellent. Another area that you've been embellishing on for your column that you do for Mini Europe that many of our viewers see is the ethical considerations. Could you just outline those a little bit? What are the ethical considerations that radiologists need to take account of, do you think?
So there are a lot of biases in AI. Not in the AI itself, but more in the data that's used in the training and the validation of AI. And what we're increasingly seeing is people becoming aware as they curate, aggregate and label these big data sets that there are biases in there which humans weren't particularly aware of beforehand, and it kind of holds a mirror up to the radiology community saying this is how accurate you are on certain data sets, and it's actually we were performing worse than we thought we were. So bias is one of the ethical things in AI that needs to be addressed, and there are certain organisations who are trying to address the bias. There's an NHS code of conduct. People have to declare what any biases or underlying distributions in their data were.
That's the UK National Health Service,
UK National Health Service, the NHS Code of Conduct. The American College of Radiology, the ACR, also have some guidelines on the standardisation of data sets and things like that. Another thing that's often forgotten is the impact on patients of these AI things. I think everyone's so focused on impacting the radiology workflow and improving the productivity of the radiologist or the radiology service that we hear very little mention of the patient impact.
That's interesting, because I think you've mentioned before that you have patient advisors at congresses. Could you just talk a little bit about that?
Yeah.
Who's the person that has been at ECR, for example?
So at Kheiron, we brought our patient advisors, a doctor called Liz O'Riordan. She's a breast cancer surgeon who unfortunately got breast cancer herself, and she's now found herself in the situation where she realised that what she thought she knew as a doctor about breast cancer really didn't translate into what the reality is for a breast cancer patient. And when it comes to applying AI to mammography, as we're trying to do, we've actually recruited her to come to us and be rigorous with us about how we're communicating what we're doing to patients. Why are we getting patient data? What are we using the patient data for? What will be the impact of our software once it's deployed in the NHS? And she's led patient engagement events for us. They've helped us with our branding. The name of our products has been helped with some patient engagement. And I think I haven't seen that many other companies at ECR talking about the patient side of things. So I'm really happy that she was able to come out here with us.
Good, glad that's worked out. Now, the other aspect is the radiologist's role after implementing AI.
Yeah.
Could you talk a little bit, any advice, any special hints that you might be able to pass on?
So I think the radiologist's role is going to change slowly, but ultimately do quite a big shift away from being a pure clinician to being sort of a hybrid between a clinical and a data manager of sorts. I gave a talk on the first day of the conference on where I kind of saw the shift of the responsibilities of the radiologist going, and I think we're going to start seeing that diagnostic radiologists are going to have a more broad understanding of the basics of the data science that underpins algorithmic development. Things like the basics of statistical reporting, how to produce a sensitivity and specificity metric, to understand more about receiver-operator curves, the nuances of the prevalence of disease and how that affects the reported accuracy of systems. And also on top of that, it's about data curation. GDPR will govern everything we do about the sharing of data, and I think it would be really good if radiologists
GDPR is the data protection.
Good data practice research.
Yeah.
I can't remember exactly the acronym, but it's widespread across Europe, and you can get training in that as well. And I think radiologists would be well served to have an understanding of that framework as well.
Good. Okay. So lots of homework for the viewers. Hugh, thank you very much for joining us. Enjoy the rest of the Congress.
Thank you.
And I hope it goes well for you.
Thank you.
This is Philip Ward from Aunt Mini Europe signing off.